Picture this. You wake up one morning and you feel this all too familiar heaviness deep down in your lower belly. So you head to the bathroom, you sit down, and you wait and wait. Nothing happens. You strain a little harder, still nothing. But by your third or fourth attempt, you realize something has shifted, and definitely not in a good way. Now there's real pain. We're talking a deep, throbbing ache radiating right from your lower back, and this quiet, terrifying little voice in your head whispers that something is seriously wrong. Well, welcome to this explainer, because today we are diving into an urgent investigation of a terrifying biological reality, one that millions face but literally nobody wants to talk about. We're talking about fecal impaction. Okay, let's just get right into this. To understand this visceral nightmare, we really have to look at the mechanics of your gut. Your large intestine is, well, it's essentially a 5-foot-long drain winding through your abdominal cavity. And its primary job? To absorb water from whatever passes through it. And let me tell you, it is brilliantly, ruthlessly efficient at this job. But here is the terrifying part. When waste stops moving forward, your colon doesn't know how to turn off. It just keeps pulling water out hour after hour, day after day. Silently, it drains all the moisture, turning soft, manageable waste into a massive, rotting, cement-like rock that gets hopelessly stuck inside your rectum. So the crucial question we have to ask is this. What actually happens when your body traps a rotting stone inside you? This is a massive, high-stakes medical emergency, particularly if you, or maybe someone you love, is an adult over the age of 60. We're going to break down exactly how this trap is set, how your body desperately tries to warn you, and most importantly, the absurdly simple emergency protocol you absolutely need to know to dissolve this blockage before it becomes catastrophic. Section 1. The Silent Biological Nightmare. Just look at this timeline. It really shows how this builds like a silent, ticking time bomb. Days 1 and 2, things just kind of slow down. You might just feel mildly full, no big deal, right? But by days 3 and 4, the colon is relentlessly draining moisture. By days 5 and 6, the waste inside you is literally the texture and density of hardened clay. And by days 7 or 8, you're dealing with a cement-like blockage. I mean, think of trying to push a rough, misshapen stone through a garden hose. The stone won't compress. And the harder you push and strain on the toilet, the more you just wedge that mass in. It's a slow-motion disaster. Now, for adults over 60, this is basically a biological perfect storm. First off, as we age past 60, intestinal muscle contractions just naturally slow down. Second, the natural thirst reflex genuinely weakens. This leaves seniors chronically dehydrated at a cellular level, meaning there simply isn't enough water in the waste stream to begin with. And finally, daily medications. Things like blood pressure drugs, opioids, antidepressants, even your standard iron and calcium supplements, they can chemically paralyze your normal digestive motility. So you've got missing thirst, slowed muscles, and everyday meds silently setting this trap. Honestly, it is not your fault. Section 2. 4 deceptive warning signs. Okay, pay attention to this one, because this is the symptom that sends most people in the exact wrong direction: watery liquid discharge. You might see this and immediately assume, oh, I'm not constipated, I must have a stomach bug or diarrhea. But the terrifying reality, a solid, rock-hard mass is completely blocking the exit. The newer, looser waste, coming from higher up, literally has nowhere to go, so it just seeps around the edges of that solid blockage and leaks out. Medically, it's called paradoxical diarrhea. And listen to me, if you take anti-diarrheal medications right now, the kind that paralyze intestinal movement, you are locking that blockage in and allowing it to grow. Never, ever take anti-diarrheals if you have watery discharge alongside a heavy, aching feeling of rectal fullness. And the other warning signs? They are just as bizarre. Experiencing a painful trickle of urine? Well, your rectum and bladder are neighbors in a very confined space. A swollen, hardened mass in the rectum physically crushes the bladder wall, partially blocking the urethra. What about unexplained lower back, hip, and thigh pain? That's actually the severe rectal pressure radiating outward. But perhaps most frighteningly for seniors is sudden mental confusion and agitation. The sheer systemic physical stress and toxic buildup can trigger what looks exactly like a cognitive episode. If an older loved one is suddenly confused out of nowhere, always consider their bowel status. Section 3. The tearing point. This brings us to bowel perforation. Keep in mind, the intestinal wall is living muscle tissue. As this blockage grows, that living tissue gets stretched way beyond its capacity. It loses its blood supply and literally starts to die. Eventually, it hits its absolute physical limit, and it tears open. When that happens, fecal material, bacteria, and toxic byproducts spill directly into the completely sterile abdominal cavity. This causes a rapidly progressing, devastating infection called peritonitis. Without emergency surgical intervention, this is fatal. Once it tears, your window of survival violently narrows. Because of that, these are your absolute red flag 911 symptoms. A rigid, board-like abdomen that is intensely tender to the touch, a fever spiking above 101 degrees, sudden, severe, constant pain, and I mean constant, not crampy, a complete inability to pass even gas, or a sudden drop in blood pressure accompanied by cold, clammy skin. Let me be perfectly clear, these are not wait and see if I feel better tomorrow symptoms. These are call an ambulance and go to the emergency room immediately symptoms. Section 4. The Emergency Left Side Protocol. Before we do anything else, step absolute 0 is this: stop straining. Put the brakes on immediately. I promise you, not once in human history has white-knuckling it on the toilet dislodged a hardened mass. Pushing against a solid rock inside the rectum only skyrockets your intra-abdominal pressure, severely inflames the tissue, and practically guarantees physical damage or tearing. Just stop. Instead, here is the exact, absurdly simple emergency protocol you need to defuse this time bomb. Step 1. Take 2 to 3 adult glycerin suppositories and generously coat them in water-based lubricant. Why so many? Because one is rarely enough to coat a completely dehydrated mass. Step 2. Do not stand up or sit on the toilet. Lie down on your left side. Medically, this is called the left lateral decubitus position, and it naturally aligns your colon so gravity actually assists you, all while taking the pressure off your rectum. Insert them deeply. Step 3. Lie perfectly still for exactly 30 to 45 minutes, no exceptions. The glycerine needs that time at body temperature to melt, penetrate the outer surface of the stone, and stimulate the rectal wall to release fluids. Now, if you wait your 45 minutes, go to the bathroom, and nothing happens, do not panic. If the first round fails, you're going to rest for a full hour. Walk gently around your home. Drink a full glass of warm water to help relax the intestinal muscle, and then repeat the protocol exactly as described one more time. You see, the first round often just softens the outer shell of the blockage. It's that second round that is needed to finally break the core. But hey, let's be real. If you've done 2 full rounds and you still have no movement, it is time to go to urgent care or the ER. And listen, this isn't a defeat. It's exactly the correct clinical decision. At the hospital, they have clinical-grade enemas that use much larger fluid volumes delivered under safely controlled pressure to break the mass from above. And if that fails, a specialist will perform a manual disimpaction. Let's just be completely transparent here so there's zero fear or embarrassment. A physician will physically break up and remove the mass digitally under sedation, meaning you feel no pain at all. It is a highly safe, well-established procedure, and the immediate drop in pressure and pain you'll feel is profound. Section 5. Preventing the next blockage. Okay, you survived it, but how do you stop it from coming right back? Here are your non-negotiable daily maintenance requirements. First, hydration is the absolute foundation. You have to drink 6 to 8 glasses of water daily to actually give the colon moisture to draw from. Second, walk 20 to 30 minutes after meals. Physical movement literally triggers peristalsis, which are those muscular waves of the gut. Third, review your medications with your doctor directly. Fourth, and this is a big one, stop relying on daily stimulant laxatives. They chemically force the intestine to contract. And over time, your gut muscle becomes dependent on them and literally forgets how to move on its own, leading to a paralyzed, cathartic colon. Finally, establish a consistent morning bathroom routine within 30 minutes of waking up. You've got to train your body's natural circadian rhythm. And there is one more remarkably simple mechanical fix you can implement today. The human body simply wasn't designed to sit at a 90-degree angle. By placing a simple step stool right under your feet to raise your knees above your hips while seated, you physically unkink the puborectalis muscle. That's a sling-like structure that naturally chokes off the rectum. This one tiny mechanical change produces dramatic improvements, especially for older adults dealing with weakened pelvic floors. We've covered a tremendous amount of ground in this explainer today, and we've peered into a rather dark corner of human biology. So I'll leave you with this final, provocative thought. Is your body silently turning your waste into a weapon right now? Your digestive health is deeply intrinsically connected to your overall survival, and ignoring a lingering stomach ache or brushing off a few days without a movement can incredibly quickly escalate into a life-threatening emergency. Never brush off your gut health, drink your water, and take action before the silent drain traps you.